Obsessive compulsive disorder, or OCD, is a severe anxiety disorder which can best be understood through this case study. So there was a 38-year-old woman who feared contamination of germs almost her entire life. Her entire day would consist of thinking about germs and how to prevent them from coming into her life. Once the thought about germs entered her mind, she could not dismiss it, no matter how hard she tried. The only way to make the anxiety go away was to clean and wash excessively. She kept her child in one room, which she regularly scrubbed from floor to ceiling to prevent any germs from getting into the room. She even opened and closed doors with her feet to avoid getting germs on her hands. So, as you can see, OCD has two components, which is a cognitive and a behavioural component. And the cognitive manifests itself in obsessions, and the behavioural component shows up in compulsions. So, an obsession. This is a repetitive and unwelcome thoughts enter this person's minds, as well as images or impulses, and the person can't do anything to stop them. They actually hate these thoughts and they find it very difficult to dismiss or control them. The behavioural component, the compulsion, these are repetitive behavioural responses which are extremely difficult to resist. Compulsions can be covert or overt. So in our case study of the 38-year-old lady, she was having overt compulsions, which was cleaning excessively. You can see them happening, but sometimes there can be cognitive compulsions, such as repeating a string of words inside the person's mind. Now, the reason that these compulsions happen is because they reduce the anxiety and make the individual feel better until the next obsession begins. If the person doesn't perform this compulsion, it can lead to a panic attack. And that's pretty much OCD.